It is Saturday, April 18th. And welcome to our daily COVID-19 Task Force update. Joe Delro and Ujets. Beautiful Saturday afternoon. As a matter of fact, so beautiful that half of the crew here today almost didn't make it on time because out in the yard doing some yard work and doing some various things like that. And it's just a great day. So if you're out there, enjoy it. Just make sure you have the social distancing and personal distancing, whatever you want to call it, and don't mix and mingle. Just stay together as a family. All right, today it's a smaller show. We have with us from the Kahnawà Memorial Hospital Center, the Executive Director, Lisa Westaway, who will talk a little about the elders today. So let's welcome her once again, Lisa Westaway.
Thank you. So today I want to talk a little bit about home care because we haven't spoken a lot about home care. We've spoken a lot about inpatient, Elders Lodge, ILC, but we have many elders who are at home, who are receiving care on a day-to-day basis. And so I wanted to talk a little bit about that just so that you're aware of some of the adaptations that we've made with respect to COVID-19 also in those situations, just to reassure you again of the safety of our elders right now for even when they're receiving the medical care that they need. So our home care team of nurses are visiting approximately 200 patients right now. So in fact, those numbers have risen because what we're trying to do is decrease the amount of visits to the hospital by people who are over 70, and so we've increased the number of blood tests that we're doing at home and the number of visits, and on other instances we've decreased the amount of visits as well, doing some follow-ups by phone. So some of the adaptations that we've made, always calling ahead of time, so it's really important in this particular case. So just to compare a little bit with inpatient or the Elders Lodge, our seniors, our elders there are in a controlled environment. So we're able to ensure all the safety measures within the environment are there so that the nurses also have the safest environment possible. But when we're going into your homes, there's a little bit of a variable there. We don't have full control of what's happening in each and every person's home, and therefore our nurses have to be extra precautious, both to ensure that they're not bringing the virus into homes and that they're not taking the virus out of the home and bringing it to their colleagues or back to work. So some of the things that we're doing, again, like we're doing in all of our other areas, are calling ahead of time, doing screenings over the phone before we come into the home. And our nurses are also doing the screening that I spoke about that's happening for all the employees at the Elders Lodge, at ILC, and at KMHC inpatient. So our nurses have to fill in a questionnaire before they come to work while they're still at home, self-evaluating their symptoms, and should they have symptoms, then they don't come into work. They stay at home and they speak with our staff health nurse. So we also are respecting all of the safety precautions when we go into your home. So when we're less than 2 meters at a 2 meter distance with a patient, then our nurses wear a mask. If patients have any symptoms, then they would be asked to wear a mask as well. And our nurses change their clothes when they come back from visits. So we're following all the same procedures as we were doing in the past, but and as we're doing everywhere else. But what's really important, and what I want to talk about today, is that variability and the importance within your homes to respect the social distancing that we speak about. So that means that if you're having many visitors in your home, it's important to let our nurses know that when they call before they come for a visit. Of course, if you're over 70, you should not be having visitors in your home. You should only be having those people in your home who actually live with you. And even then, if you're over 70, you should try to maintain social distancing within your home as much as possible, especially if those who live with you are going out. But if you're living alone and you're over 70, it's important to try to stay by yourself. And that's why it's really important important that we count on all of our community members to have an idea and know who their neighbors are, who their family members are that are living alone, so that we all can participate in decreasing the isolation that our elders may be feeling at this particular point in time. It's been, I think we're going on week number 6 of self-isolation and social distancing, and so it's really important to take care of our elders and to give them a phone call as much as possible, a few times a day, just to make sure that everyone's doing okay. So again, I want to say a big thank you to those at home who are respecting the measures and ensuring not to put other people in danger, and a really big thank you to the nurses in home care. Actually, and I should talk about also the home healthcare aides from KSCS, because actually the services that we provide in the home it's a very big collaboration, and we work very closely together. So thank you to all of you who are taking really good care of our elders who are at home at this particular point in time. I wanted to just talk a little bit about the stress and anxiety that we might be feeling, and health and wellness. We often talk about 4 elements that are particularly important. We talk about our mental well-being, our spiritual well-being, our emotional well-being, and our physical well-being. And so last weekend, I think I gave you a bit of homework this week to try to think of the things every day, what you've learned, what's positive, what's new, what you want to remember after this is all over that that you might want to implement as changes in your life. Well, maybe a little bit of homework for this weekend would be to think about those 4 elements: your mental, your spiritual, your emotional, and your physical well-being, and maybe try this week to just one element to add in an activity that would speak to one of those 4 elements in your life, and so that you're focusing on those elements of well-being, and at the same time allowing yourself to feel that anxiety, feel stress, and feel the emotions that you might be feeling, because again, we all handle and are handling this situation, each of us in our own way, and there's no right or wrong way to how we might be feeling right now. So I urge you to just be mindful of yourselves and what you may be feeling, allow that, and then move forward by trying to do little activities that maybe could help to make you feel better. So lastly, I just want to talk about the guidelines we have in place. They are still extremely important. We must maintain them. We must still stay with our only close family members that we live with. We must maintain social distancing if we go out. We must continue to wash our hands, sneeze into our elbow, throw out our Kleenexes as soon as we use them. Always washing our hands and staying the course. So I urge you again to keep up the good work. We're moving into a new week, and we hope to come back this week with more elements that will allow us to make decisions to move forward. But right now, we still are at the same place. We still are seeing increases in a number of deaths. We're seeing even some younger deaths. We really feel that it's especially important right now to maintain what we're doing. We are also seeing many changes happening to the south, beaches opening up, and people going back to work, anarchy happening in certain states. It's really scary, actually, and I've never been prouder, really, to be part of a community that is so, working together and moving in the same direction, and having one goal in mind of protecting each other. So we need to keep that up. We need to keep thinking about each other. We need to keep supporting each other, and we'll get through this. So thank you very much. Enjoy the weather, and I think I'll see you on Monday. Okay, thanks.
All right, thank you very much, Lisa. Today is, as Lisa said, there's still people dying. We have to really take it seriously, and I know I don't like to editorialize too much here, but when you realize how well we're doing, don't take it for granted, because if you look, even from where we're standing, we could see Dorval. And Dorval has had a terrible outbreak with, you know, a couple of dozen people, more than a couple of dozen people now have passed away, 3 dozen or so, in one place. And that's within eyesight of here. So don't take anything for granted. Stay the course. As a matter of fact, if you were outside today, you probably noticed some military helicopters going from the direction of, say, Ontario, coming into Montreal. And they're bringing in some medical staff from the Canadian Army. The Quebec government has called for some help. So they're bringing in some medical staff. So it is still very serious here. And, you know, let's all stay the course. Just a couple of notes here. I want to say thanks, as always, to our partners, our media partners. For example, K1037. If they're not running this live, they'll be running it very shortly after we do this. It'll be on Paul's Cable 3, channel 300. Within the hour, usually it's on the air. So for those who don't have the Facebook, you know, you'll get to see this or get to hear it. Thanks to the Eastern Door, Yuriwaze. Speaking of Yuriwaze, it's Jordan Stand-Up's birthday today. Just want to say happy birthday to him. Just a couple of notes before we leave too. There, as we said, there are things to do. I know people are doing lots of beadworking. I imagine we're going to see some of the most brilliant beadworking in the next few months as we go along, as even those who are just starting out are going to get better and better and better at it. So that's kind of neat. Also, don't forget to, there's an opportunity to clean up the town. The cleanup challenge is still going on up until Friday. Just call the, just call, who are we calling again?
Waste management.
Waste Management, thank you, because I don't have that note in front of me here. Kahnawà Waste Management, just check out Kahnawake.com, you'll get all the information there. And you get to take a picture of the place you're cleaning before and after. There are over $1,000 in prizes that will be given out at the end of the week. So that's something for you to do. Again, do it in a family group. The people who live in your home, just do it that way. You don't have to take, you know, a square mile of territory, just maybe a quarter acre that you can clean up, and it'll help make Kahnawake nicer to look at, be a nice little bit of exercise, and just a good thing to do. Also, one last note, there is a survey going on, and it's going on until tomorrow at midnight. How do you think, how are you doing during this time? How has the task force, are you happy with how things are going? Are you happy how the task force is doing? Please take part in that. It goes on till tomorrow at midnight. We'll be compiling that, and then it'll be announced a little later on. There are links at the COVID-19 KMHC.ca site. Also, right here on Facebook at Kahnawà 911. So if you can, take a few moments to do that. It would be very much appreciated. We very much appreciate that you were joining us today, taking some time. We hope that we've been helpful, and we will be back tomorrow with another daily COVID-19 task force update. On behalf of everybody here, Nyao Ko Dano Onagiwahi.